I've just had the pleasure of sitting through an amazing talk which has been talking about how we can use patient-centered care to improve outcomes. If you just would be able to introduce yourselves and tell us a little bit about who you are and where you've come from.
Hello, my name is Dikaia Chatziefstathiou. I'm coming from Canterbury Christchurch University in Kent in the UK, and I am the Director of Sport, Human Rights and Safeguarding Research Group.
Hello. My name is Dr. Yetsa Tuakli. I'm coming from the Yale School of Public Health in New Haven, Connecticut, and I'm the Director of the Sports Equity Lab.
So you've been telling us a little bit about a project that you've been working on together today. So would you be able to tell us a little bit about the project and a little bit about how it relates to patient-centered care and reducing inequalities?
Yes. Today we presented a project that was about trauma-informed care with female refugees, but can be scalable and relatable to other equity-deserving groups that participate in recreational programs in sport. I had this idea because one of my students started having this kind of ideas for a project, and then I reached out to Yetsa, and we had a lot of brainstorming sessions in terms of trauma-informed care. That I can say that Yetsa introduced me into the principles of trauma-informed care, and we started discussing more how can we apply it in the sport context that has been quite not so common. I don't know if you want to say something about the trauma-informed care as well.
Sure. I'll start by just mentioning a little bit about sport. So as you know, sport is one of those entities and forces in life that's just ubiquitous. It's got universal appeal, it's got global salience, it's impactful for pretty much every aspect of society. And so we thought, can we use the power of sport to improve or to see if that could improve the mental health and just well-being of an equity-deserving group, in this case refugee girls. The building blocks of sport are very similar to the building blocks of trauma-informed care. So there's teamwork, there's camaraderie, there is shared vision, shared goal setting. And so it seemed natural to link trauma-informed care and trauma-informed approaches to sport in a group that probably needs it more than any other group.
But also quite important to actually make sure that that there are practices that do not re-traumatize and re-victimize the participants. So sport can have some negative and dark side. So sport many times is being used as a healing practice. But what our project wanted to investigate is, has it been taken into account the darker side of sport? When female refugees are taking part in the sport? Have they been taking care of all these kind of different areas where they can possibly be damaging for them? So this was the main point, yes.
So it's really fascinating research, and as a doctor who's interested in mental health, I found the idea of using sport in a formal way and measuring the outcome of that really interesting. And so I know that you have a bit of a background in sports. You're an Olympian, so that gives you a little bit of an edge when you're coming to bring these things to science and to quality improvement. So you've spoken a little bit about some of the challenges that you faced with people that are already traumatized. What were the positive outcomes of the project, and how did it improve people's outcomes and reduce inequalities?
Yes. We interviewed few female refugees. Actually, there were 2 female refugees that had already confided that they had been victims of sexual abuse from family members. And then one coach that was also a refugee, a male coach, and a senior administrator. And all of them unanimously mentioned how positive it was for their mental health. Even the male refugee coach said that he felt stronger and more empowered by actually being a coach into a team. And then the female refugees, they said that they felt a sense of belonging, a family. They are dislocated by moving countries, but in this new space of sport, they felt more safe. They felt that they could connect with each other. There were other female refugees that they had similar experiences. So the sport became the glue, the social glue for them in a completely new environment that they were very dislocated.
Mm-hmm. And yes, I do have a very personal connection to sport. I used to train with the Ghana national team as a near Olympian. I was on the national team at the continental level. But sport's not like unlike society in that it could be positive, it could be negative. It's got a great opportunity, I think, to bring elements of camaraderie and empowerment to individuals and communities. But if it's not executed responsibly, it can be just as damaging as any other traumatic experience. So it's nice to hear about your interest in mental health, a budding mental health doctor here that's going to definitely serve his country really, really well. And it's just important to be mindful and intentional about any intervention, make sure we're doing it responsibly in a way that empowers and prioritizes the patient voice, asks them on a regular basis with a scaffold of trust and communication how they're doing. And even sport can be made better and sport environments can be made more responsible. And I think that's what this research really kind of brought to light.
Totally.
Well, thank you very much. And it was really, really interesting to hear about something that was so tactile and thinking about sport, as you said, which is so universal, and the way that we can apply that to help people in healthcare as well. So thank you very much.
Very quickly, just some recommendations that we thought that there are also some positive attributes, but there have been some gaps, and it's very important to have some recommendations that is more informed care and awareness that the female refugees are equity deserving groups. They can be re-traumatized if there is no care as part of the team. Many times we think that sport can just be beneficial by definition. No, we need to leverage the good attributes of sport, and that's why it was important in an audience like today that was made of doctors and policy officials, different kind of groups. They need to come together and see how we can make sure that we provide a safe, psychologically safe environment for equity-deserving groups. Okay, thank you.
Well, thank you very much. So final question from me. What would be the main take-home point, either from your talk today or for something else that you've learned at the conference?
Well, I have to say that first of all, I keep learning from my friend and colleague Yetsa. When she talks, I'm very inspired. And today, in one of the answers that she gave into the audience was about making sure that we have responsible sport and the mind and body, and I would add also spirit, they're always together and they're not disintegrated. And also in the session earlier about leadership, I just learned so many things in terms of how resilience can actually be culturally relative, or what I consider resilience can be different for me and you. So it's about personalized patient care, and also to recognize that it's not to blame the doctors or the system, to have the power of the will that a small team can do something big and impactful. And that is what we learned in that session today from our colleagues from Lambeth Council. It was really important. Very small group of people with a genuine interest, they did something so big. So it's important to understand this kind of the power of good people coming together.
That's a tough question. The takeaway, what Dikaia said about the power of good people coming together can't be overemphasized. I think for me, it always comes back to relational health. I mean, we really think about mental health, we think about physical health, we think about social health, financial health. But if we take care of each other in a mindful way, that really constitutes relational health. And sport can definitely be a vehicle for that. So can very, very excellent mental health doctors, like one of the ones standing next to us to our left. But the opportunity for relational health to also not be attended to is also there. And so really being mindful about taking that as sort of another element of health that we look at very carefully and closely, I think for me is an important takeaway.
Fantastic. So yes, certainly looking at health from different angles and bringing lots of good people together can be really helpful. So thank you very much for speaking to us, and thank you very much for watching our video.